Thank you to my sponsor, Cake Wallet, where you can store, send, receive, and exchange your Monero safely on your iOS and Android devices. Hey everyone, and welcome back to my channel, Girl Gone Crypto. I'm so excited. I've got a really special guest here today, Ray Dogum, who runs the Health Unchained Podcast. And so we're going to be chatting all about just different trends and things that are happening in the world of healthcare and blockchain. So Ray, thank you so much for joining me today.
Yeah, thank you so much for having me. I really appreciate the work that you do in the community, and I like to watch your videos and follow you on Twitter. So great work. I think it's really important, having that voice out there. So really appreciate it.
Oh, thank you. Well, I'm really excited to have you on and get to chat, because one thing I think is really interesting about people who do a lot of interviews and run a podcast or something is you get to talk to a whole variety of people. So you have this really interesting perspective. And obviously there's a lot of talk about how blockchain technology can benefit various industries, and the medical industry, in particular, is one that I think could really benefit from blockchain technology. And so in the many episodes you've done and different things, different people you've talked to, maybe just to start out, tell us a little bit more about why you wanted to start this podcast and what is kind of your vision for the Health Unchained podcast.
Yeah, absolutely. So, I started getting into the crypto blockchain world, at least 5-6 years ago now. And when Ethereum first came out, I looked at that like, wow, this can really apply to a lot of industries. At the time, I was doing my MBA and focusing on healthcare management. So the whole industry of healthcare is very complicated and dynamic, and it really suffers from a lot of the same issues that our other industries face, like trust issues. How do you truly value something, and how do you transfer that value over the internet, for example? So things like Bitcoin and other cryptocurrency protocols, what they do is focus on like money or other types of value. In the healthcare world, in the medical world, you have data, and data is what's really valuable. Patient data, provider data, data for images, so like x-rays, any sort of imaging, any kind of behavioral health data, all that is valuable. I think right now our industry isn't built to capture that value. So a lot of companies are trying to capture it themselves and use it to build AI bots or generate some value that way. But the person or the people that are actually generating that data are not being compensated in a way. So I think in the long view, I think blockchain will help enable individuals to reclaim that value themselves, and hopefully, we'll get reimbursed for the activities that we do related to healthcare.
So kind of on that, obviously, like you just mentioned, data is incredibly valuable and important. How do you see blockchain technology kind of changing the game for that? Like, do you see various potential companies that are partnering with healthcare industries, or what could that potentially look like?
Right. So there's actually a number of different consortiums that have been developing the last couple of years. I think the first one that was really major was called MediLedger, and that was back in 2017. And that included companies like Pfizer, Walmart, actually McKesson, a lot of big companies in healthcare. And they were really going after the drug supply chain kind of industry, or not industry, rather the drug supply chain part of the healthcare industry. So right now what's happening is these groups are coming together trying to figure out what the hell blockchain really is and how it's going to help them. So I think it's going to take a long time before it becomes like something most people understand in the healthcare industry. And my goal with the podcast with Health Unchained is to really just bring those stories, bring the top leaders that are using blockchain and tokenomics, and just start having those conversations, because it's kind of confusing for most people, especially if you're doing healthcare for like 20, 30 years, you're an executive, you're not really looking at blockchain and Bitcoin as a way to change or revolutionize your industry. It's just not something most people are considering. So I started the podcast like over 2 years ago now, and I have about 63 actually today, 63
Oh,
episodes.
congrats.
Um, yeah, and I think that's kind of the purpose of the podcast, is to really just tell those stories, share it with the community, make people aware of what's going on, and just talk through those issues. I like to keep my episodes relatively long, so it's kind of long form. They're each at least an hour long. So yeah.
So, speaking of kind of highlighting these stories and different use cases and things, I mean, there's obviously so many aspects to the world of healthcare. You know, you've got the doctors, you've got the patients, you've got pharmaceuticals, hospitals, there's so many things. And so, in terms of some of these people you've talked to and stories and things that you're seeing, what aspects are you seeing like actual blockchain implementation in so far? Like, is it certain areas seem to be more accepting of it than others?
Right, it's a good question. When I first started out, there were a lot of really excited people trying to use blockchain in a way that creates a sort of like a decentralized electronic record system. So instead of using centralized systems now, a couple examples of what I'm talking about are things like Epic or Cerner. These are electronic medical record systems that hospitals use. So all these startups came up. They're trying to create their own personalized ones that the patient controls. And although the idea is, sounds good, the issue is there's so much that goes into patient record management, and there's a lot of regulation around it. There are laws around how that data should be managed. So that hasn't really gained much traction, to be honest. A lot of good ideas, but nothing really coming out of it. What has gained some traction are use cases where there actually is no PHI. So, data that's private to patients. So things like provider credentialing, for example. So let's say you have a doctor who's interviewing to start at a hospital. The hospital has to look at their resume and also look at all the credentials, where they worked in the past, their certifications, licenses, all these things that need to be verified. And right now it's a very manual process. So provider credentialing has been one use case where it includes no patient information. So easier on the regulation side. And, lots of companies have started out trying to work on this sort of use case. So it's been interesting watching that. As I mentioned before, drug supply chain is a big one. There's also this idea of a decentralized identity. And this is not specific to healthcare, but it's kind of a general theme with cryptocurrency and blockchain, is the ability to own your own identity and manage it, and not have to provide so much of your personal information to parties in order to, operate something with them, right? Or gain some sort of utility with them. So that's been something that's been growing as well. In general, there has been this idea of open science. So in order to have scientists share their data when they're doing research, that could be clinical data, it could be basic research science, and blockchain has been, discussed as a way to create new, incentivization models to share data. Because right now, when people do research and science, typically speaking, they are trying to, be the best in what they do. So they're trying to publish a paper, get credit for that paper, and kind of keep it to themselves. They're not sharing it as much. But I think that theme is changing a little bit. So I think and blockchain, I think, could help facilitate that transition.
So one thing you mentioned was, regulations and how difficult that is to work with. And so what would need to change, or what would need to happen for some of these regulations to be easier to work within and implement new technologies? Like, does that, I don't even know who publishes HIPAA compliance and all these things, but like, would that happen at the national government level, state levels, or is it a mix of both of those?
Yeah, it's a good question. So I think it'd probably be a mix of them, but I think so HIPAA is a federal level regulation. And what's interesting now is, given all the things that are happening with the COVID-19 pandemic, a lot of those regulations are starting to get a little bit relaxed. So one example is for telehealth. and this is could somewhat be related to blockchain. But in telehealth, in the past, if you were in California and you wanted to see a provider for the first time, a provider who's not licensed in California, you wouldn't be able to do that legally over telehealth. So the provider needed to be licensed in the state that the patient is in at the moment of the visit. Even if you are like a resident of New York, but you're visiting California on vacation. So that has been dropped. So now providers can actually, uh, have service patients anywhere in the country. I think there might be some limitations around that, Medicare specifically or Medicaid specifically, but
Yeah.
that's just an interesting change that's happened.
Yeah, that
Um,
is really interesting. And that's a perfect segue into something else I wanted to ask you about because obviously, with COVID-19, it's just been a huge shift in a lot of industry, but especially in the medical world. You mentioned telemedicine. My dad's actually a doctor. I had to like teach him how to use like Zoom and video conferencing and things so he could still see patients. And it's just been so interesting to see this shift. And so, you just mentioned some of these laws getting relaxed, telemedicine, but what else are you kind of seeing in terms of things that are changing due to this pandemic? And what do you think are going to be like maybe some permanent changes that might come out of this?
yeah, really, it's hard to say what would come out of this exactly because,
Mm-hmm.
there's just so much uncertainty in how our laws are created or revised or generated. I do know that there is more interest in blockchain overall in the
Mm-hmm.
government. I think that has not just in healthcare, but also in the finance world. Even if you think about universal basic income and how that might be actually implemented, there are talks of using blockchain for that. But I think in terms of just tracking who has COVID-19, for example,
Right.
and what kind of testing has been done and what states, it would be great to know which states are, you know, less affected or which states are doing a good job with quarantining. And we simply don't really have the data to
Mm-hmm.
make those conclusions. With blockchain, I think that it will allow potentially these individuals or people to share information in a sort of secure, private way. Um, so I think there are some talks in government around how contact tracing can be done with some sort of blockchain tools. Um, Still kind of early. I don't know how, embraced they're going to become, but it is something that I have seen articles on and talked to people about.
Mm. Now, in terms of like telemedicine, actually, I saw that you interviewed Doc.com. I actually just interviewed them last week. And so I'm just curious, like, do you think coming out of this, we'll see more people wanting to do telemedicine? Like, I'm not going to lie, it's kind of nice to not have to drive and wait in the doctor's office and do all that. Like, is that something you think that we'll see change coming out of this?
Yeah, absolutely. So one thing I didn't mention early in the episode was I currently work at a telehealth company. So it's not a
Oh,
blockchain-based company, but
got
it's
it.
called Amwell, and it is in all 50 states. And ever since, March or so, we've seen such a surge in utilization of the platform. It's been, pretty crazy actually and exciting. I think it's been, I just had like a few weeks ago a provider training. So
Mm.
typically we go on site to do provider training. So helping them to understand how the platform works, how to, adjust their settings. But in this case, we're not going on site anymore. Obviously, we're doing all the training remotely. And I had a provider training with over 300 people, 300 doctors, staff, clinical teams, which is a lot. Typically, it's more like 10 to 20 people. So obviously, there's a huge interest in telehealth. It's not going to go away. If anything, it's just going to keep on developing. I think what is interesting now is another regulation that the government has relaxed is the utilization of HIPAA compliant telehealth tools.
Mm.
Now doctors can basically use any tools. They don't need to use HIPAA compliant tools. They can use Zoom, they can use FaceTime, so Skype. So I don't know if you heard about that. And coming out of that, what's interesting is Zoom has gotten a lot of, you know, like a bad rep actually for some of its like uh, poor security and privacy protocols. But what's even more interesting is I think just last week, and I know this is being published later on, but recently Zoom acquired Keybase, and Keybase, was developed originally with a public-private key infrastructure. So I think Zoom is interested in blockchain, is what I'm hearing, and that's what I'm getting. So I think it's really going to be interesting how that plays out.
No, I agree. I think that Zoom is a very interesting company to watch right now, not just because of that acquisition you just mentioned with them trying to address some of these privacy things, but a few weeks ago I saw something about how they integrated a crypto paywall as well. And so I think there's a few things pointing to them being potentially interested in blockchain, which I think is really cool considering how much they've boomed. Like, I wish I had bought Zoom stock a few months ago. I don't know,
Yeah, I actually don't get why that's the one that became so popular. I feel like there's so many video conference tools. That one just maybe it's an easy name to remember, Zoom. I don't know.
Yeah, I don't know. That is actually an interesting point. Why Zoom over Skype, over StreamYard, over whatever. But yeah, for Teams, for whatever reason, here we are. So.
Right. And I actually I don't know if you've heard of Jitsi. Jitsi is like a WebRTC based video conferencing tool, also free.
So, Ray, it's been so awesome getting to chat with you and just to kind of pick your brain on what you're seeing in the healthcare industry and, where this could be going and, especially everything that's going on with COVID-19 right now. So I really appreciate you coming on and just sharing your thoughts. Where should people go to check out you and your podcast?
Yeah, no, thank you for having me. I had a lot of fun. And I think, everyone, if you want to check out my show, I'm on all the major platforms. So Apple Podcasts, Stitcher, Spotify, Google, SoundCloud, all of them. So go to healthunchained.org and you can get a link to all of them. So it's the best place to reach me.
Perfect. Well, thank you again so much, Ray. I really appreciate it.
Awesome. Thank you.